On behalf of Professor Kaushik Ray and my co-investigators, it gives me great pleasure to deliver this lecture entitled Lowering PCSK9 through siRNA-based Therapeutics, a revolution in the management of a common disease. This is just my disclosures. So as we're all aware, cardiovascular disease remains the leading cause of death mortality globally. This is both in low and high income countries. Now, one of the major causes of cardiovascular disease is atherosclerotic cardiovascular disease. And we are aware that LDL cholesterol is the pivotal risk factor for this condition. Now, we are aware that treating high cholesterol is important, but this is a very recent publication on the Da Vinci study looking at prescribing habits in Europe. And in over 6,000 patients, you can see that the vast majority of patients are not achieving the previous LDL cholesterol goals set in 2016, and definitely not achieving the newer, lower recommended LDL goal targets in the new 2019 ESS guidelines. So while statins and ezetimibe constitute first-line therapy for patients with elevated LDL cholesterol, there remains a need for additional lipid-lowering agents for patients who cannot achieve their LDL treatment targets. The newer therapies are the PCSK9 monoclonal antibodies that have been available for a few years, and I'm going to be talking about an emerging therapy, Inclisiran, a small interfering RNA. So what about monoclonal antibodies directed against PCSK9? They have a unique mechanism of action. They bind all PCSK9 within the circulations. We now have two large outcome cardiovascular trials, the FOURIER study and Odyssey outcomes, which have shown benefit in terms of reduction of risk of myocardial infarction, stroke, and coronary revascularization. Unfortunately, there are limitations of this therapy. These drugs have to be administered every 2 to 4 weeks. There's the potential for developing of immunogenicity, and one major hurdle is the cost and access of this therapy. So if we look at the administration of a PCSK monoclonal antibody, PCSK9 levels are dramatically decreased, which lasts for about 2 weeks and then slowly start increasing. As a result, LDL cholesterol is reduced, but unfortunately with this therapy, you get this seesaw in your LDL cholesterol level, and this because the action of this drug only lasts for about 2 weeks. So what about small interfering RNA targeted against PCSK9 synthesis? In other words, the production of PCSK9 within the liver, rather than mopping up PCSK9 within the circulation. And this harvests a normal process within the cell, small interfering RNA, and the drug is called Inclisiran. It gets incorporated into the RNA-induced silencing complex or RISC complex, and then is recirculated within this complex. So it has a much longer duration of action as opposed to monoclonal antibodies. So this is just with the first proof of concept, looking at PCSK9 levels after a single dose of Inclisiran, and with following a single dose at now the dose that's gone to market, the 300 milligram dose of Inclisiran, PCSK9 levels are reduced for up to 6 months. So this is one of the first phase 2 studies called ORION-9, looking at the efficacy of Inclisiran following a dose at day 1 and then a second dose at day 90. And you can see that the levels of LDL are reduced by about 50%. And following the second dose, it can take up to a year for the LDL cholesterol to return to baseline. So as a result of these preliminary early studies, phase 1 and phase 2, there's been an extensive program called the ORION program, which has had a look at the use of Inclisiran in different patient profiles. And I'm going to concentrate on the pivotal phase 3 studies, which are called ORION-9, which is in heterozygous FH, and ORION-10 and 11. So this is just looking at these 3 studies. ORION-9 was in heterozygous FH patients on a stable, low-fat diet, and study inclusion was an LDL cholesterol of greater than 2.6 millimoles per liter or 100 milligrams per deciliter. ORION-10 and 11 were very similar. One was done in the United States, the other one in the rest of Europe. And these were patients with established atherosclerotic cardiovascular disease or at high risk, what we would call atherosclerotic cardiovascular disease risk equivalence. The entry LDL cholesterol was an LDL of greater than 1.8 millimoles per liter or 70 milligrams per deciliter. There were large populations. ORION-9 had just under 500 patients with familial hypercholesterolemia. ORION-10 and 11, just over 1,500 patients with atherosclerotic cardiovascular disease. Despite therapy with statins and ezetimibe, the entry LDL cholesterol levels were still high, very high in ORION-9, 4 millimoles per liter or 153 milligram per deciliter, and about 2.7 millimoles per liter or about 105 milligram per deciliter in ORION-10 and 11. This was despite the use of high-intensity statin in over 2/3 and a high use of ezetimibe, at least in ORION-9, less so in ORION-10 and 11. All the studies had a similar design. Inclisiran or placebo was given at day 1, again at day 90, and then every 6 months until the end of the study, which was at day 510. And the subjects were randomized 1-to-1 to receive Inclisiran or placebo. So this is just a summary of the primary endpoint of the studies. There was a remarkable reduction in LDL cholesterol in the order of 50%, 49 to 52% in all 3 studies. In terms of absolute risk reduction, the reduction in LDL cholesterol was about 50 milligram per deciliter or 1.34 millimoles per liter. In fact, it was higher in ORION-9 because of its higher starting LDL cholesterol level. So because of the marked reduction in LDL cholesterol, many more patients achieve targets that are now recommended. So nearly 80% of patients achieve the target of less than 100 milligram per deciliter, slightly less in the ORION-9. The target of 70 milligram per deciliter was achieved by nearly 2/3 of patients in ORION-10 and 11. And the much lower targets that we're now currently recommending are also seen in over 50% of the patients, at least in ORION-10 and 11, not so much in ORION-9 because of higher starting LDL cholesterol levels. So if we look at the percentage of patients who received a greater than 50% reduction in LDL cholesterol, it was about 40% in ORION-9 and over 60% in ORION-10 and 11. What about side effects of this therapy? There was very little difference in side effects between Inclisiran and placebo, except for injection site reactions, but these were all mild and transient, none were severe, and none were persistent. So it seems to be a very safe therapy for patients with hypercholesterolemia. So Inclisiran is really a paradigm shift in the treatment of hypercholesterolemia. Unlike oral therapies such as statins and ezetimibe, which have to be given every day of the year, 365 days a year, unlike monoclonal antibodies, PCSK9 inhibitors that have to be administered every 2 weeks, Inclisiran is only administered once every 6 months. No dose adjustments are required for renal impairment or hepatic impairment, and this therapy really addresses missed doses. So other than local skin reactions, which are all mild and transient, there doesn't seem to be any adverse effect from this remarkable therapy. So in conclusion, while statins and ezetimibe constitute first-line therapy for patients with elevated LDL cholesterol, there remains a need for additional lipid-lowering agents for patients who cannot achieve their LDL treatment targets. The durable potential LDL cholesterol-lowering agents are needed that are effective for patients whose therapeutic needs are not currently met, that do not impose additional burden on the patient. And the data from the ORION clinical program suggests that Inclisiran could meet this challenge for appropriate patients, and because of its durable and sustained reduction in LDL, may even become the initial therapy of choice for patients at high cardiovascular risk. Many thanks.